With advancement in science and exponential technologies at our disposal, we can really prevent every single chronic disease and cancer. And it is not about having a wearable or going for routine diagnostic test. If you really want to prevent obesity, type 2 diabetes, cardiovascular disease, chronic kidney disease, NAFLD, IBD, cancer, erectile dysfunction, you have to fix your oral health. Unfortunately, we do not care much about oral health, and we generally go to a dentist only when we have an unbearable pain. Your oral microbiome, the microbes living in our mouth, directly impacts what happens in your gut. It directly impacts, what happens in the mitochondria, what the mitochondrial function, right? So your oral microbiome could produce nitric oxide that dilates blood vessel, that acts as signal for GLUT4 to clear the glucose from the circulation, that dilates the blood vessel of sex organs to prevent erectile dysfunction, and oral dysbiosis of oral microbiome could allow certain bacteria to enter the bloodstream, travel to brain, and produce certain harmful metabolites such as gingipain, which causes dementia. It could move to liver, causing liver injury. It could lead to overexpression of or overproduction of TMAO, which again causes heart disease. It could lead to production of uric acid, which could suppress your nitric oxide production. Even every tooth inside your body, is connected with specific organ, right? And every teeth is an electric fuse, so it controls the flow of electrons and voltage and current to every single organ. So if you have a broken tooth, if you have gone for root canals, right, it disrupts the blood supply to that tooth, and then it disrupts the flow of electrons to the organ which is connected with that specific tooth, right? And without electrons, your cells cannot function, your mitochondria cannot produce energy, right? And cancer cells actually thrive in this low current, low oxygen environment, right? So every single cancer have one thing common, two things common in fact: mitochondrial dysfunction and oral infection, right? So starting point of every single cancer is your mouth, right? So fix your oral health. If you really want to prevent all these diseases, these variables and all these, tracking your HRV and stress and all these things is not going to help until unless you're fixing your oral health.